Yep.
Okay.
Yes.
All right. So welcome, everyone. We'll get started. And so, as Sarah's indicated, it's been quite a process to get to this point to be able to report some results of the scoping literature review that we have been working on for now, about a year and a quarter. And so as we go through some of the results, it may kind of seem a lot of information, so interrupt us anytime, or we'll definitely have a discussion at the end. So just to remind everyone that the overall guiding question for this review was this. I'll let you just read it to remind yourself. And so as we did this scoping review, it was co-led by Rush University and University of Minnesota. In addition to the co-principal investigators, we had students from Rush, we had Lent Fellows and a postdoc from the University of Minnesota. So the cutoff point for the articles was 1990. And then it was an international review. So many of the articles are not from the US. We reviewed 4,571 abstracts that were triaged, including reliability on the triage, and then about 500 articles were fully reviewed, of course, with the assistance of all the people that were helping us. So what we want to do to kind of start this off, the Lent Fellows for their project created about a 3-minute video summarizing this process from their perspective. So I will play that video clip and then we will unpack some of those results on the following slides. So stop share. All right.
Hello and welcome to our presentation. Hello, our presenters today are Anka Gransel, Ben Coop, Melena Bates, and Will. People with IDD face poor health outcomes due to a lack of access and discrimination in healthcare. This presentation focuses on the first step of the 5-year process to create an interprofessional education IPE curriculum to train healthcare professional students to treat people with IDD.
The main research question is, what is the state of education of healthcare professionals and what has been accomplished since 1990 in the development, implementation, and evaluation of curricula and training materials and practices for healthcare and social services professionals to address the health, mental health, and other needs of people with IDD. The article review process included screening over 4,950 abstracts.
Here are the results. We divided by the primary and reliability coders. Of 207 total publications, 60 was rated as effectiveness of training or interventions. And then the majority were either development or descriptive research. And so in some, the majority of the studies were not interventions, and the state of the field is still relatively nascent. Next is the word cloud. The higher frequency, the words appears to be bigger. And so words like student and disable, care, learn, and those words stood out. And again, these are the type of words that have appeared, the emerging words that have appeared in our collective coding process.
For inclusion criteria, which resulted in 460 texts being included in the full review. The coding was done by primary and reliability reviewers, and some of the key points we collected data on were theoretical and conceptual framework, type of intervention, focus population, involvement of people with disabilities, key findings and how they were measured, as well as any recommendations for practice.
After our preliminary scoping review of the literature that exists surrounding education on IDD, some themes are starting to come to light. There is absolutely a need to involve people with IDD and their family members when it comes to designing these programs, whether that's carrying out, planning, or evaluating the programs. Much of the previous work that's been done has not properly involved people who have IDD when designing the training programs for health professionals. But much more rigorous study design is needed in order for future clinicians to be able to make informed decisions regarding the best practices for their patients and families.
So this is just a nice snapshot by the Land Fellows about the big picture. So back to our presentation. So the slides below will review some of the graphic or quantitative data, as well as some narrative findings and selected recommendations based on the key data extraction questions from the scoping review. So this is just to indicate that we had reliability coders for about 18 to 20% of the articles. As Belle indicated in that short video, this is kind of the distribution of the types of articles. So you can see that there were quite a few articles evaluating the training program or curriculum. There were a lot of descriptive studies and studies describing a development of a curriculum or training. Now, as you may recall, Sarah in our last meetings talked about that our main model of framework used for the review was the socio-ecological theory. And so we try to code a level at which each of these articles was addressing the curriculum or training that we were evaluating. So you can see that the majority of article focused on some kind of a relationship between the individual with a disability, and it could be with a professional, with a family member, or someone else. There were also a lot of articles at an organizational level. So that could have been a clinic, a university, for example. And then for the others, there were not as many of those articles. And this level of ecological model then will influence our next step that we will review at the end of this presentation. So there was another important data extraction question. Have people with disabilities been involved in the development or implementation or evaluation of the training or intervention? So you can see that the majority of articles did not include people with disabilities in the process of their study or project that they were reporting on. And so as in the video clip, Will mentioned that is a real area of need. A similar question, whether family members of people with disabilities were involved in any of these studies. Again, that there's a vast majority of articles that did not. There were a few that had that involvement. So this question was very important to us, as well as the others, and interesting. So was the activity or training, or did it include a component of interprofessional education or IPE? So again, the majority of articles did not include an IPE perspective explicitly, even though that is a major focus on our own project. But we'll certainly be looking carefully into those articles. There's about 100 of them, 120 maybe, that did explicitly mention IPE. The other piece we wanted to look at is what kind of pedagogical or educational approach was studied or was being developed. And so you can see that most of the articles did not define a pedagogical approach, but there were studies that primarily use the traditional approach to teaching, which is didactic teaching. There were some articles that include the service learning method, authentic teaching, and case studies. And very few, for example, included team teaching, even though, as you will see in the recommendations, that was one of the issues that I think they will need to look at further. So this is just the majority articles did report some kind of outcomes. In articles where outcomes were not specified, those were typically more conceptual articles that just did not have an evaluation component. And then recommendations. So there were majority of articles again had recommendations based on the findings. And so in the following slides that are more narrative, we'll just point out some selected recommendations. They're not comprehensive in this particular presentation, just some highlights for you. So one of the recommendations was to make sure that meaningful collaborative relationships between patients, families, and professionals are created. So the kind of the team, the relationship building was very important. There was an article on educating pharmacy students. And this was a theme that was very common, is to increase coverage of information about students or children with autism in their curricula. And so this was the focus on how to work with children or youth or adults with autism was definitely one of the themes going through all these recommendations. Now, the next bullet is kind of related to IPE and also the team building. And so they talked about the importance of including team members from more than 2 disciplines, including social workers, OT, PT, as they were working with people with IDD. The next kind of a big bullet is focused on making sure that variety of disabilities are covered in these various curricula, and then a social model of disability is used, not just medical model that was really present in most of the articles that we reviewed. And the second bullet on this slide is again focused on the autism spectrum disorder. And in this particular recommendation, they wanted to establish a graduate program certificate focused specifically on interprofessional education in autism. The first bullet on this slide focused on, they talked about how it's important, rather than focusing on a cohort of students in the training program, it's really important to individualize to the needs of the students. And so the individualization was a recommendation. The next bullet focused on making sure that technological advancements were taken into account when developing curricula. And then the last bullet on this slide, again, is focused on competence on working with children or adults with autism spectrum disorder, specifically being able to communicate with those patients. So here are a few more. The first bullet on this slide discussed how it's important to take into account human rights legislation when training medical and healthcare professionals. The second bullet highlighted kind of the feelings of the family and people with disabilities themselves, and making sure that the training includes and is conveyed with dignity and understanding, rather than just technicalities of treatment. And the last just highlight was there was a specific article on a women's health module that included focus on patients with intellectual and developmental disabilities, and that was highlighted as an effective approach to training. So this is just a comment that the graphs that we showed, the reliability wasn't perfect for all of the coding. There was specifically some questions that the reliability was lower than 80%. And that was the presence of pedagogical approaches and then coding the levels of socio-ecological model. As you can imagine, in a lot of these articles, it was not explicitly stated, or it was stated in a very cursory manner. And so sometimes there just was not perfect agreement. So kind of just to wrap up here, what our next steps are. We have identified several questions into which we need to look deeper. And so we are going to be selecting articles that have at least one of the following. They would have to have at least one theoretical model used to frame the article. They would have to have some sort of an aspect of diversity addressed, involvement of people with disabilities or their family members, have an explicit statement of socio-ecological model level at 3 or above. So that's more of the systems levels. They would have to have pedagogical approach specified model of disability other than medical, described IPE, some outcomes listed and recommendations listed. So we will select all of those that have at least one of these characteristics, and then we will dig deeper into those articles to learn more and to use the information to then build sort of curriculum materials as our next step.